Did you know that Americans buy more than 14 million gallons of toothpaste every year, but roughly 25% adults do not brush their teeth twice a day? Not only does that increase the risk for developing tooth decay, but it could lead to bad breath and other things as well. Nobody wants stinky breath and everybody wants a really good smile. So over the next 30 minutes, Dr. Malik Johnson, a dentist with Eric J. Sandler, DDS Associates, will be answering all of your oral health questions, especially things that happen during the summer months. So thank you for joining us.
My pleasure.
All right, we want to make everybody know that they can get in on all of this and ask you their own question. The number is at the bottom of the screen, 336-379-5775. Ask your question anonymously and the doctor will answer. All right, so let's do this. Picture it, we're all on vacation, right? Because it's summertime, and your tooth gets knocked out. How should one go about getting it taken care of? What should we be doing when this happens?
Ooh, well, the first thing you should do is pray. Hope with someone pretty close you can get to. But we actually see this quite often, especially during the summertime. Kids are out, things like that. Everyone's playing a little bit more. If you have a tooth that comes out and you can see the whole tooth, the best thing you want to do first is put it in milk, actually. Milk has calcium ions and things like that in it that help kind of restore and keep that tooth vital a little bit longer. So if you can get a tooth knocked out, find your cup of some milk. First things first. The real best thing is this solution called Hank's Special Solution, but no one has that. So milk, and then you want to find a dentist as soon as possible. Teeth, you can actually re-implant them, put them back in the socket. The sooner you get to it, it's more successful within that first hour.
Okay.
So first thing you want to do is pray, find some milk, and find your dentist as soon as you can.
Okay, so it would be worth then calling if you're on vacation to see if you can get a dentist wherever you are to get that done and not like wait a day or two till you come home.
Absolutely. After a day, blood starts to fill that socket, and then the tooth won't be able to kind of get in there anymore. So the sooner you can get that tooth to a dentist and get it in and maybe even get it splinted, they might put a wire on it to keep it in place, things like that, the better. After a while, unfortunately, if a day goes by or even several hours, 6 hours or so, there's not much hope to get that tooth back in place.
Okay, so what if your tooth gets chipped or gets cracked? And I had this happen on a Labor Day weekend one year. Oh my goodness, what a big mess.
Whew, chipped or cracked, similar. You want to find your dentist ASAP. Sometimes if you have the fragment that cracks off, you might want to keep that as well. There's no point in putting that in milk, but you can bring it in. Sometimes the dentist can temporarily reattach it or at least gives us a model to go by when we're kind of restructuring the tooth. If you have pain, ibuprofen is kind of the first line of pain and inflammation type of medication that we like to recommend. But a lot of people, when you chip a tooth, there is a lot of pain that accompanies that, right? So you want to first get out of pain, possibly want to find ice and a cold compress just in case you have any swelling. And come see your dentist as fast as you can, because you're going to try to drink, you're going to try to eat, you're going to try to do things with that cracked tooth, and it's not going to be fun.
It is not fun for sure. All right, so what kind of things can we do now to avoid the potential for dental emergencies?
Definitely want to visit your dentist 2 times a year. Get those checkups, get those cleanings, get those x-rays so we know what's going on, so we can identify any issues. You want to avoid certain things like opening bottle caps with your teeth. If you're playing sports, you want to wear a mouth guard. If you're riding motorcycles, things like that, mouth guard might be a good idea. Helmets are always a great idea. Like I said, don't try to open any bottles. I would avoid certain hard candies, popcorn kernels, pork skins are something that often cracks teeth as well. Chewing ice is something I would probably avoid in moderation as well too, because we only get one set of these, right? So you want to take care of them as best you can and be as gentle with them as best you can.
My mom's a dental hygienist. She always told me your teeth are jewels, not tools. So don't be using them for anything, right? Okay. All right, let's talk about our toothbrushes, because everybody has a toothbrush at home, but they're probably not either A, using it right, or B, not changing it out often enough.
Yes, using it right is a big thing, right? A lot of people, I brush, I'm still having these issues, but a lot of people aren't brushing long enough or thoroughly enough. So as dentists, we recommend 2 minutes of brushing your teeth in the morning and night. And 2 minutes is a significant amount of time. That's about half a song. So if you brush your teeth and you 30 seconds and spitting it and keeping it going, it's not long enough, right?
Okay.
And we also recommend soft toothbrushes, soft bristles. The mediums and the hards can be abrasive, right, and cause a little more damage to your teeth than you think. So soft toothbrushes, a lot of patients ask me, is an electric toothbrush better than a manual? Um, they have the capacity to do the same things, right? But the electric toothbrush takes a little bit more of the work off your hands. So a lot of times I will recommend patients get those electric toothbrushes. But the biggest thing is making sure you're spending that time, um, adequate time, 2 minutes, getting in, you go over everything a few times. I tell a lot of people make sure you get the corners. So the back teeth is where you do the most chewing, right? So you want to keep those super clean, spend some time just in those corners. Every 3 months or so, I say quarterly, you want to be swapping that toothbrush out. If you notice those bristles start to get worn, start to bend, just don't look straight, pointy, and like they can really clean, then yeah, you wanna swap that toothbrush out as soon as you notice that. Some other things, definitely want to encourage flossing, right? The whole idea of flossing is you get food that gets stuck in between your teeth because our teeth are tight together, right? They have tight contacts to one another, and food gets in there. And if you're not flossing and getting that food out, then bacteria starts to grab a hold of that food, starts to adhere to the tooth, and that's basically the formation of cavities.
So a lot of
Um,
times in summertime, you got sleepovers, you got travel, maybe somebody forgets their toothbrush and someone says, oh, well, you can just use mine.
well, it sounds gross. Um,
Yes, it does.
in some instances, it's not as gross as it sounds. Definitely, family members, if that's something you have to do, that's something you have to do. But we definitely recommend everyone use their own toothbrush. Keep your germs, it's your germs. Um, and if you're in a situation where you just desperate and you have to use your mom's toothbrush or your sister's toothbrush, then you'll be okay. But overall, we want to encourage everyone to get their own toothbrush. Come in, get dental cleanings, dental visits, so we can give you these things, right? You come get a cleaning, we give you a toothbrush, we give you toothpaste.
Right.
So come see us. Everybody's scared of us, but I promise we don't bite.
All right. Hang tight for me. We're going to take a quick break. We're going to continue to take your text questions when we come back.